Hi, I'm Veda. It's very nice to meet you. I'm a technician here. I'm going to be doing all of your medical testing today, okay? Perfect. Now, I know you've been waiting a while to get in for this appointment. It's very thorough and comprehensive, but nothing should be painful at all, okay? All right. So I'm just going to start by hooking up some electrodes for you so we can go ahead and get a reading throughout the full exam. So I have these. I'm actually going to put them on your neck. I'm going to put one over here. Just get in here. There we go. Smooth that down a bit. And one on the other side. Okay. Yeah, they're very sticky, but they don't leave any residue. So they remove pretty cleanly, which is really nice. And then I will put one on your temple here, over here. Okay. Very careful not to get that in your hair. And then the last one is going to go on this side, your right temple. Just get that in there. Okay. Good. Thank you. All right, so I'll have those set up so we should get readings throughout the entire testing, and that'll help as well. Now I am going to listen to your heart rate. Rather, your heartbeat, excuse me. So let me just come in here, and it's a little cold as usual, so I'm just gonna put this on your chest. You can just breathe normally for now. Listen to your heart rate. You. Now a nice deep breath. Good. And exhale. Okay, good. I'm going to reach around behind you and put this on your back. Okay. Alright, nice deep breath for me. Good, thank you. And exhale. Okay, and then the other side. Okay, another nice deep breath. Right, good. Thank you. Your lungs sound really good. Okay, coming back to the front, I would like you to do a deep breath and hold it, okay? Breathe in on the count of 3, and then I'm going to have you hold for 15 seconds. I'll count for you. So go ahead. 1, 2, 3, in. Deep breath in and hold. 1, 2, 9, 10, 11, 12, 13, 14, 15, and go ahead and let that breath out. Thank you very much. Okay, we're going to try that one more time on the count of 3. Just a nice deep breath in on the count of 3, okay? 1, 2, 3. Breathe in and hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and go ahead and let that breath out. All right. Did you find that you had any trouble holding your breath for that duration? Okay, good. It didn't seem like it, but I always like to check. Okay. I'm just gonna grab my notepad over here. So when is the last time you had an annual physical? Okay. And was everything normal? Okay. Did you have blood tests at that time? Yeah. And anything elevated or low? Okay, good. You taking any medications currently? Okay, yeah. How long have you been taking that? And do you know your dosage? All right. 50 milligrams. Have you been steady on that dose for a while? All right. And that is working as desired. We don't need to talk about changing the dose. Okay, fabulous. All right. Now, this next part, I'm just going to have you look at this card. And can you read this third line for me here? Just the third line. Good. And then I'm going to cover your eye, read the 4th line for me, okay? Very good. Okay. Now can you read the 5th line for me? Okay, try that with both eyes for me. Okay. Now with just this eye again. Okay. So it seems like your left eye might be a little bit weaker than your right eye. Have you been to the eye doctor recently? Okay, yeah. Yes, okay. Did you bring a copy of your prescription? Oh, fabulous. Okay, so I can check with the desk because they've scanned that there. But okay, yeah. So left eye is a little bit weaker, but it seems like your vision overall is pretty good. I see you're not wearing glasses. You're not wearing any corrective lenses either. Okay, yeah. All right. That's not so bad then. So generally, when do you wear your glasses? Okay, yeah, driving, working, that kind of stuff. Okay. Any issues with night blindness at all? Yeah, pretty typical, especially where you wear them while driving. So just continue to do that. Continue to go to your eye doctor, of course. And I am going to take a little look in your eyes. So I have this light right here. I'm going to shine it right in your eyes. So go ahead, just look at me. You can look right at my eyes. Don't look at the light. Very good. Good job. Okay. It's kind of bright, I know. Alright, thank you. Good job. Alright, I'm going to come really close for a second. Just look in your eyes really close. Okay, good. Other side here. Good, thank you. Alright, now I'll have you follow the light just with your eyes. Don't move your head, okay? Go ahead and follow the light. Very good. Okay, smooth tracking on your eyes. Following the light. Excellent. Now look at my finger. Now look at the light. Look at my finger. Now look at the light. Look at my nose. Good. Now look at the light. Look at my nose. Now look at the light. Okay, look at my nose. Now look at the light. Look at my nose. Now look at the light. Very good. Okay. Now go ahead, look at the light. Yep. Alright. What shape is it making? Yeah, circle. Good. Okay, now this side, look at the light. And what shape is it making? Yep, triangle. Excellent. Okay. Go ahead, look at the light again. And tell me when it's at its brightest. Good. Okay, coming back. Good. And other side, when is it brightest? Shining right in your eye. Good. And coming back. Very good. Okay, now look at the light. Look at my finger. Look at the light. Look at my finger. Go ahead and look at the light. Look at my finger. Okay. How many fingers am I holding up? Good. And now? Very good. Okay. Now I'm going to bring the light in. Go ahead, focus on it as it comes in. Good. And then as it comes back out. And focus on it as it comes in, getting bigger and bigger and bigger. And then comes back out. One more time. Very good. Okay, that was perfect. All right. Set that aside for now. Might have to come back to it in a bit. All right. Now, I'm going to take a look at your skin. So we're going to get a close look. I have another light here. Come in and take a close look at your skin on your face. All right. Good. Just a little bit of texture. Do you exfoliate generally? Okay. Can you tell me a bit about your skincare routine? How often do you wash your face? Okay. And what kind of face wash do you use? Yeah. I like that one too. That's a good one. Yeah, not a lot of extra additives in that one. Definitely want something without fragrance, so that's a good choice. Do you use any serums? Okay. And do you moisturize? Okay. Yeah, that's a good routine. With the texture on your face, I might suggest adding a exfoliating serum like an alpha hydroxy acid or beta hydroxy acid. So that's AHA or BHA. And that can help with exfoliating and smoothing the skin. But your skin looks really good. I'm not seeing dryness or oily or anything. Yeah, I'm just coming here really close. Look at your nose. Your pores are actually really tiny, so that's good. I have some visible pores on my nose. Need to work on that, but you look amazing. Okay. Alright. And now my hands are entirely clean and sanitized. Do you mind if I just touch your face a little bit? Okay, thank you. Alright, so this is part of the process, so I can actually feel sort of the texture of your skin. Just a little bit of bumpiness. But overall, very smooth. And I'm not really feeling much in the way of oil. But it doesn't feel dry either, so that's good. Definitely don't want your skin to be parched, but I think your routine is really helping you. Okay, now I'm gonna just take a couple swabs from around your face. So I'm just gonna come in here very carefully, get a couple swabs down here and right on your nose. Okay, very good. All right, and then I also grab another one here. Good. Okay, I also like to swab your eyelids a bit. Some people have some sort of dermatitis on the eyelids, sometimes oily. Have you had any issues with itchy or dry eyes? Okay, so we'll just get in here just a little bit so you can close your eye. Get a little bit on that eyelid. Alright, the other side. Yeah, I'm just being very gentle. I don't want to poke you in your eyes at all. Okay, that's lovely. Okay. Very good. So skin looks pretty good. I am going to do some rubbing on your skin of your arms. Just get the top layer so we can do some testing on that. This is kind of strange, but we have this special tool. Looks like a lint roller, but what it actually does is it takes the sort of top layer of your epidermis, the dead skin cells only, and then we're able to use it for testing. So I'm just gonna come over here and I'm just gonna do your arm. It's a little sticky but not uncomfortable, and again, doesn't leave a residue. So good. Excellent. Okay, almost done with this side. Now we'll do your other side. Alright. Perfect. Alright. So we'll put that in for testing. Alright. So next I'm going to have you identify some colors for me. Just grab that. Sometimes we use a color light for this, but today I don't think we need to do that. So can you tell me what this color is? It's blue. And this color, it's purple. Can you look at the blue? Good. Now look at the purple. Good. Now look at the blue. Excellent. Back to purple. Okay. And how about this color? Yep, that's pink. All right, so look at my finger. Good. Look at the pink marker. Very good. My finger. Now look back at the pink marker. That's perfect. Okay. So that is just fine. Set that back aside. And just a quick check here. Can you tell me what this animal is? This one? Yeah. How about this one? Yeah, good. And how about this one? Very good. Okay, how about this little guy? This guy. Yeah. Let's see. I'm trying not to repeat. How about this one? Yeah. Alright, and then how about this one? Yes, very good. Okay, how about this one right here? This one. Can you see that? Okay, yeah. And then last, this one, this little guy. Yeah, excellent, very good. Okay. I am going to take a look at your scalp. Just come up here a little bit. Okay. Good. All right. Looking through your hair, taking a look at your scalp. All right. Yeah, everything looks good. I'm actually gonna take this comb and I'm going to just do a little bit of brushing of your hair and sort of a scraping of the scalp. Good. Okay. Alright, that's good. So we'll take that, grab that back. Okay. And is it okay with you if I take a very small trimming of your hair from somewhere that's not noticeable? Okay, excellent. Just get in here. I'm gonna come back underneath here. And we'll just take a little tiny piece. Alright, and then a little piece from over here. Excellent, okay. So I literally just took the tiniest little piece. Go ahead and test that. Okay, so I would also like to pluck a couple of hairs from the root, okay, so that I can actually do testing on the root of your hair. So I'm just gonna come in and take one from over here, okay, just a little pluck. And then take one from this side as well, just a little pluck. Okay, alright. So, oh, I got 3. Okay, so I have a couple little hairs here. Put that over there. Alright, excellent. You're doing really well so far. Alright. Now, I am going to take a few measurements of your facial features. So come in here and we'll just measure full distance of your eyes. Good. And to your mouth. Okay. And height of your face. Just get this myself more to work with here. Alright. Okay. And then the width of your jaw. Okay. Just go across the whole width of your jaw. Good. You have a really nice strong jaw, but not anything extreme, just a nice jaw. Okay, width of your forehead. Good. Height of your forehead. Okay. Do height of the full face. Width of the cheekbones. Do your right ear. Good. And left ear. Good. I'm going to do the diagonal of your face. And other side. Alright. I'm going to do the height of your nose. Very good. Okay, can you do a big smile for me? Alright, thank you. Okay. And then resting mouth. Okay. Go ahead and close your eyes for a second. And open them. Good. Just keep them regular how you would at any point, not like way open. Okay. Good. Alright. Okay. Very good. You have really excellent proportions of your facial features. Okay. And can you tell me a little bit about your diet? How many meals do you eat usually in a day? Okay. And snacks? Yeah, I'm a big snacker. Okay. And now, if you eat breakfast, what time do you usually eat it? Okay, yeah. And lunch? And dinner? And when do you usually have snacks throughout the day? Okay, yeah. And can you tell me a little bit about what food is in your home right now? Okay, yeah, alright. So, what do you typically get for groceries? Are we talking a lot of fresh fruits and vegetables or mostly prepared foods? Do you eat meat? Yeah. How many times a week? All right. Thank you. Yeah, I know they say to really shop the perimeter of your grocery store where you have the fresh fruit and vegetables, and then the back would be like meat and fish, and then the other side would be like frozen items, and stay away from the center of the store as much, but that's where my favorite foods are, so I understand. Okay. Lovely. Now I am gonna take a look in your ears. I'll look at your right ear first. Get in here. Okay. Your ears look really nice and clear and clean. That looks really good. Okay. Just getting the best view I can. I'm gonna pull back on your ear just a tad so that I can see all the way in. Okay. Yeah, that's really good. So, do you clean your ears out frequently? Do you remove your earwax? Because your ears are extremely clear. Yeah. Okay, good. I'm gonna look at your left side, assuming it's gonna be similar. We'll see. Good. Yeah, also nice and clear. I'm gonna pull back on your ear again. Good. Okay. Yeah, not a buildup of earwax, just normal, healthy ear. Your eardrum looks good. Okay, fabulous. Any history of hearing issues? Okay. Well, I'm glad to hear that. And you're not finding that you have any issues that are coming up with your hearing, with your ears in general, tinnitus, itchiness, anything, pain? Okay, fabulous. It's good news. All right. All in all, you seem to be in very good health, and pretty much everything that we have done today in terms of test and data gathering, we should get the results back for it in the next 3 to 5 days. So we will be in touch regardless of the results. Everything will be uploaded to your patient portal, and then usually the next day our doctor will get in touch with you after they have reviewed all of your results. So at that point, if anything looks out of the ordinary, we can come up with a treatment plan for it. But as far as I'm seeing today, everything looks really, really good. Do you have anything that I should be aware of? Any issues that you've been having? Okay, yeah. And when does that typically happen? Okay, absolutely. Now, how long has it been taking you to fall asleep? Yeah. Alright. So, for something like that, where it's not exactly something that we're covering in any of these tests, if it's something that's been persisting for a while, oh, yeah, I think we might want to get you into our sleep clinic, and then we can take a look at it overnight and see what might be causing that. Have you been tired the next day? Do you feel like you're not getting enough sleep or your quality of sleep is low? Yeah, okay. So with those issues of insomnia and then really not feeling rested the next day, we might want to get you into the sleep clinic. What I would like to do is wait the 3 to 5 days for the test results so we can see what's going on with everything else. And then when you are on the phone with our doctor, they can give you a referral to a sleep clinic. And I'll put it in the notes here that that's something we want to look into. Also, that will give us a way to look at your results and your data and see if anything can be pointing us toward a cause, okay? All right. So I'll make sure that the doctor is well aware of that issue and we can get that sorted out for you. Is there anything else? Okay. Well, I appreciate you coming in for your testing. I know it takes a while, but I think it's the very good way to keep track of your health, and at least it's not painful or anything. So I'm just gonna come in and remove these little electrodes. All right. Get these back on here so we can dispose of them properly. Just come over here and get this one. Good. And the ones on your neck as well. This one. And last one. Okay. There we go. Alright. So you are all set. Yeah, no residue, which is good. Alright. So we will be in touch. As I said, 3 to 5 days. You'll see it in the portal first, and then we usually call the day after. Alright? Well, it was very nice to meet you, and I hope everything works out. And we will also be talking about the referral to the sleep clinic, okay? All right. And I will see you out.